I had been having trouble breathing, so I went to an outside facility that was closer to home, and I visited their emergency room, and they sent me home with a nebulizer, and that evening I collapsed. And I was with my then 1.5-year-old, and I was 6.5 months pregnant. I went into respiratory failure and cardiac arrest. They delivered my son in the emergency room, and they life-flighted him here to Rainbow, thankfully. But I was in an induced coma there in the ICU for a week. After I was discharged, I had a follow-up appointment the next day, and that's when the ENT told me the pathology came back and that it was cancer. He said, I'm gonna send you to my mentor who's the best, and he's gonna give you the best treatment for this. And I came to Seidman Cancer Center to see Dr. Lavertu. I had surgery after surgery, and then I had radiation treatment, 35 radiation treatments. I had 7 chemotherapy treatments, and a newborn and a 1.5-year-old, and it was kind of like a blur. After treatment, I was trying to make sense of everything. The social workers from Seidman were very helpful, but I was going to groups with people twice my age, and I just couldn't make a connection. So they referred me to the Angie Fowler Adolescent Young Adult Cancer Institute and to the nurse navigator, Amelia Baffa, for support. The first thing that I was introduced to were the support groups, and in that support group, it was individuals closer to my age and life circumstance. The first time I went, I met another young adult parent that I could talk to about my experience, and we just understood each other at a different level. I felt less isolated.
I think one of the hardest parts of surviving cancer is going through the mental stages of the disease, dealing with all the emotions that come with it and how to control them, and anxiety and depression, and it's helpful to have somebody that knows what you're going through.
Having had the experience and knowing what it feels like to have somebody look at you and tell you you have cancer. Unless that happens to you, how do you describe it?
She knows how it feels to be a young person in the midst of your life when everybody else is doing things that you're supposed to be doing. Then you get this diagnosis, and it's life-shattering. Jen knows how to help people with this mental aspect of going through cancer.
I think a combination of my education and then obviously my life experience just created a drive in me to reach out to this population, to help, to give back.